Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. Dr. Pane, this week's question comes from the Facebook crowd, and it's a lady from, it looks like Boca Raton, Florida, and they're interested in a neck lift. They had a lowered facelift some time ago, and they just want to know what's going to be involved in the neck surgery coming up for a neck lift. So, Dr. Pane, what would you recommend in this situation?
Yeah, when I saw the pictures here, the person, looks good overall, but given her age, she had the initial surgery about 20 years ago when she was in her late 40s. So now she's in her late 60s, and there is some neck banding showing up and some cheek laxity. So facelift is one of the rare operation where a second time procedure is in some ways easier, less difficult per se than a first time procedure. That's not common in most forms of surgery, most different specialties and so forth. But that is because the nature of the tissue in the face is pretty forgiving. So usually what happens is when you do a secondary facelift, and here I would recommend the secondary face and neck lift to address that banding. If you try to do just the neck alone, oftentimes it doesn't quite allow you to redrape the skin properly. And people will tell you that they can do a mini this or mini that. They may or may not be telling you the truth. Sometimes it's just being told and you're actually going to get the full thing, but they kind of want to bring you in, making it seem like what it is mini or easy or something like that. The procedure can be done without general anesthesia, so there's nothing major about it in terms of the recovery. It tends to be also painless. But if you do it the way I describe is the correct operation that's going to address the problem and give you a lasting result that hopefully should be good and long lasting for years to come. I would free up the tissue and then address the neck bands and what they call the SMAS, which is the deeper layer, the muscular layer of the face there, and addressing that with some sutures, imbricating it, and then redraping the skin and then tailoring it around. So the scars go around the ear and in the back there. And use the first time scars depending on where they were placed. They often can be used exactly as they were for the revision or secondary procedure. This basically has very little pain associated with it. The plane that you elevate when you do the surgery tends to essentially not bleed a second time around. I put special fluid in there to make it so it's minimal risk of any of that anyway. I don't even use drains when we do this procedure. So that's what's involved, essentially a secondary face and neck lift procedure. When you do a secondary procedure, you have to be a little careful that you don't get tension on the earlobe or there's certain little nuances of it. So when I say it's easier than the first time around, that's largely true, but there are a few features that have to be borne in mind when you're doing a secondary procedure so that the result looks natural. We want the person to look like a younger version of themselves. We don't want someone to look pulled, stretched, or somehow abnormal, and we don't try to create that result here in our practice. That's just something to keep in mind because you have to watch for that when you're talking about a secondary procedure. But overall, there should be very, very reasonable, satisfying, and should see a good result from what I saw in those pictures.
Well, thank you, Dr. Pane. And if you have a question for the doctor, please reach out to our website, Facebook page, LinkedIn, or Instagram account. And Dr. Pane, we appreciate your time, and we'll see you on the next question.